Hello, my name is Dr. Shantanu and I'm a senior consultant in children's blood diseases or pediatric hematology. I'll be talking to you about two common children's blood diseases, which is thalassemia and sickle cell disease. What happens, what do the children go through, and what we can offer them in terms of a cure by doing a bone marrow transplant. I thought I'll speak to you today about two common diseases, sickle cell disease and thalassemia. You might have heard about thalassemia, or you might have a relative or a friend or a neighbor who suffers from thalassemia. You would know that it's a disease that basically means that the patient doesn't have the capacity to make any blood at all. And these patients are dependent upon blood transfusions for life, which really means that every 2 to 3 weeks, unless the patient gets a blood transfusion, he will not make it to the next few months. So all of these patients would be having transfusions every 2 to 3 weeks. But these transfusions can often and in time will cause more problems because blood breaks down into iron. Iron builds up in the heart, in the liver, builds up in the eyes, in the brain, and that can cause long-term problems. So the patients would need to be on various medicines to keep them healthy. Even though the treatment of thalassemia with blood transfusion and various drugs now is much better, the only treatment that can cure a patient is by doing a transplant. And we can do a transplant if we find a donor in the family who's a full match, or sometimes we might even be able to find a donor outside the family from an unrelated donor registry. And having done a transplant, it means the patient will be disease-free for life, not needing blood transfusion, not needing any drugs at all, and they will live a complete, long and healthy life. I would also speak a little bit to you about sickle cell disease, very common disease in various parts of Gujarat, northern Maharashtra, which means that these patients have an abnormal hemoglobin, which is the cell that carries blood around. And in terms of stress or in cold, the blood molecule deforms and it stops the blood flow through various parts of the body, which means that they get severe pain, they can get strokes, they can have blindness. Again, medical therapy can help them lead a productive life, but the only cure of it again is by doing a transplant. And by a transplant with patients with sickle cell disease, we can cure them and they also will live a fairly long and healthy life without any problems. Again, to say, if you have an opportunity to be a donor, please be a donor. Or if you have a friend or a relative or somebody you know who's suffering from sickle cell disease or thalassemia, please tell them to get in contact with a good hematologist or a stem cell transplanter, and we can help them lead a disease-free life.